All right, so we are looking at what is known as chest tube intubation. All right, of course, it's a way of, you are trying to put a tube right there into the chest. Now you are putting this tube right there into the chest. This is because you want to drain out some things. You understand? You want to drain out some things. So let's look at these possible things that might lead you to wanting to put a tube into the chest to bring them out. So it's also known as tube thoracostomy. Okay, chest tube intubation or chest tube insertion, still the same thing. So it's a critical procedure. You do this anytime when you are suspecting that maybe there's air trapped up in the chest, there's pus trapped up in the chest, there's fluid, all right, in the pleural space. All right, pleural space is the area between the chest and the lungs. All right, so it's commonly performed in emergencies like maybe pneumothorax, that means there's air there, hemothorax, there's blood there, pleural effusion, maybe there's formation of fluid there. You understand? So step-by-step overview. For preparation, of course, you are trying to get into the chest wall of a person, so you have to sterilize the place so that you don't push infections in. So use ultrasound to also guide you so that you don't injure any blood vessel, you don't injure the lungs there. So anesthesia can also be used to numb the area so that the patient doesn't feel too much pain. So always insert above the rib, because nerves and blood vessels, arteries and veins, they pass just above the rib, you understand? So the tube is advanced into the pleural space, then connected towards a drainage system like this. Okay, so securing and monitoring. The tube is sutured in place, you secure it. Okay, then chest x-rays confirms placement. That's if you are not really sure. So this can be used towards treat conditions like pneumothorax, hemothorax, pleural effusion, emphysema. Okay, surgical post-surgical operations. You understand? Maybe they did some drainage, or maybe they did some injury, so they just put it to drain the rest. Okay, so risk factors is bleeding, infection, organ injury, right, tube misplacement or blockage. There's sometimes pain or discomfort. Right, so that's it for the concept of chest tube insertion.